Welcome, everyone. Thank you so much for joining and thank you for your patience while we were getting ourselves organized here. We are super excited to have the Assemblywoman here this evening to just share and give us some insight on her robust agenda that she has going on. Thank you to her Chief of Staff, Mr. Ed Gittens, for helping me and guiding me and organizing your calendar to give us some of your time. We know you're extremely busy. We also want to introduce Mr. Brian Taylor, who will be adding some supplemental points and discussion as we speak on our topic tonight. So let me just first give some additional remarks before we ask the Assemblywoman to speak. So just wanted to just say again that we're just super excited having Assemblywoman Verlina Reynolds-Jackson to join us tonight. Initially, we were going to be speaking about Black maternal health, but her legislative agenda is quite broad, as she will certainly share with us tonight, as you might imagine, and has grown to take on additional pertinent issues impacting Black and Brown communities. She's going to share with us one of her current bills, which is A4052, which is related to sickle cell disease. I actually have some personal stories to share, perhaps during Q&A. But so this is also very near and dear to my heart and the heart of my family. There is definitely a link between these two topics, and to the extent that parents can pass sickle cell disease or the trait on to their children. And sickle cell, just for those of you who may not be as familiar, it's a debilitating blood disorder that is prevalent among people from Africa, Central India, Middle East, Caribbean islands, and others of African descent, including African Americans. I do want to mention that Black Maternal Health Week is April 11th through the 17th, so we'll continue to speak on this particular topic, as this is our focus area, one of our focus areas within SPAC, State Public Affairs Committee of Junior League. And we're happy to just remind everyone, some of our newer delegates may not be as familiar, but a couple of years ago, we actually had the Assemblywoman alongside Lieutenant Governor Oliver, other legislators and advocates in May of 2021 to speak about Black maternal health. And through her efforts, as well as other legislators, Bill A1079 and S703, requiring health professionals and support staff to provide perinatal and maternal care to take evidence-based implicit bias training in May of 21. So that bill has passed. So she has many successes. I'm sure others in addition to this one. And then we're looking forward to hearing more about sickle cell. So let me just go ahead and then just proceed to read a little bit about the esteemed Assemblywoman. Assemblywoman Verlina Reynolds-Jackson is a product of the Trenton public school system and has obtained advanced degrees from Trenton State College, the College of New Jersey, Central Michigan University. Her career as a social worker, coupled with a commitment to public service, led her to the elected position of East Ward Councilwoman, where she became the first African-American female to serve in that position, and State Council Vice President and Council Vice President, where she legislated laws for the city of Trenton. Assemblywoman Reynolds-Jackson proudly served 7.5 years on City Council before being elected to fill the vacant New Jersey Assembly seat in the 15th Legislative District, her current district. Ms. Reynolds-Jackson is currently serving her third term in the New Jersey Assembly and has ascended to senior leadership, where she serves as constituent outreach chair and vice chairwoman of the Assembly Commerce and Economic Development Committee. She is a member of the Assembly Budget Committee, the Assembly Higher Education Committee, the Joint Committee on Public Schools, and the Joint Committee on Economic Justice and Equal Employment. The Assemblywoman also serves as a commissioner on the State of New Jersey Martin Luther King Jr. Commission, the Amistad Commission, and is vice chair of the New Jersey Legislative Black Caucus. Since graduating from college, the Assemblywoman has continued her education through the New Jersey Redevelopment Authority and Rutgers University. She currently teaches public policy at St. Peter's University in Jersey City. For the past 10 years, Ms. Reynolds-Jackson has been committed to serving her constituents through public service. She's achieved great satisfaction working with various populations, including her neighbors, the homeless, elderly, children, and people with disabilities. Her work has focused on social justice, enforcing business responsibility, affordable housing, environmental protection, and demanding accountability for students. Ms. Reynolds-Jackson resides in the city of Trenton with her wonderful husband, Lorenzo Jackson. And some notable memberships and affiliations: she is a proud member of Delta Sigma Theta Sorority Incorporated, the Trenton Alumni Chapter, which is my sorority. So I'm definitely so super proud to be able to introduce her. She's also a member of the Government Finance Officers Association, the College of New Jersey Alumni Association Board, the YWCA of Princeton Board of Directors, Central Jersey Chapter of the Links Incorporated, United Way of Greater Mercer County Board of Directors. So it is my honor and great pleasure to introduce the Assemblywoman, my soror, Assemblywoman Verlina Reynolds-Jackson.
Well, thank you, Victoria. That was awesome. Thank you, thank you, thank you. I want to thank you all for being here with us. This is I call it our happy hour, after work hour, where we get the chance to talk about public policy. And I really appreciate you all reaching out for me to come back. Feel like we are an advocacy group who likes to talk about public policy, and I can do that all day, every day, because I think it's really, really important. And I see we have some young people joining us over there. Hi, Sarah. And I think that's part of it, right? So I want to tell you how I started on this journey of sickle cell, and it really does start with our youth. When I started in the assembly in 2018, I wanted to give back. I said, I want to do an internship program. Now, I didn't really know what that meant or how to do it. I just knew I'm an Upward Bound student, EOF student. My office is central to all buses, and I'm right downtown, right across from the State House. I got a great location. And so I said, let's start an internship program. Even if it's just one or two, we'll figure it out. So fast forward to 2021. It was, 2021. I had at the time, I think it was 6 high school students. At this point, I started off with 2. Now I'm up to 6 in 2021. And one of them was a sophomore. Her name is Michaela. And if I wanted to do a PowerPoint, I wanted to show some pictures, but I'm still going to send them to you. A sophomore in high school, her friend suffers from sickle cell. And when she came to me, she said, my friend, and she was just upset. My friend doesn't get a chance to come to school a lot. She's missing. She can't play sports. Michaela is very outgoing. She's on the cheerleading team. She plays soccer. And so her friend, oftentimes might have to be on the bench. She can't physically do it because she suffers from sickle cell. And so she said, I had to tell my other friends, I had to teach them that it's not contagious. It's something that she got from her parents. And, sometimes she gets sick and she might be in the hospital, but that's still my friend. And I want everybody to be her friend. And I just thought, my gosh, how brave for this, I think she was 15 at the time, 15-year-old, to want to raise awareness. And I said, Michaela, this is what we do. We use our platforms to raise awareness about helping people. By way of background for myself, I'm a social worker. So I want to help everybody. And I said, so I said, well, let's think about it. How can we raise awareness for sickle cell? One, we want to be able to tell people that it's a painful disease. It's rare. It's complicated. And it does get worse as you get older, and it could be potentially fatal. But we want to still be able to get her the resources. We still want to love on her. We still want her to be able to participate in art and culture and sports whenever she's healthy. And when she's not, we want to be able to be supportive to her. We want to be able to write her cards. We want to send her video chats. We want to be able to send her messages. We want to be able, to still be a friend even when she can't be there. So Michaela came up with the idea that she had a list. She wanted to do a silent auction. She wanted to do a fashion show. She wanted to do an art show. She had a whole list of things. The good thing is her list was so vast that we were able to partner with other organizations, community organizations, and the top ladies of distinction. A lot of our fraternities and sororities, Sickle Cell is a part of their pillars in getting out awareness about it. So I said, Michaela, how about we partner and do I think it was a 2K. It's only a 2K, 1 mile fun walk, a 2 mile of 2K. And we partner with these other organizations to spread the message. We will partner with the school districts, school nurses, and it just took off. She raised over $500 by herself. We were able to partner with the New Jersey Sickle Cell Association. We partner with the whole Trenton School District. They have it a part of their healthy initiative. And that was just year one. We're in 2023 now, and we're planning another 2K, or I think we're up to maybe 3 by now. Maybe 5, we might be up to a 5K by now, but it's going to be in September when sickle cell is Sickle Cell Awareness Month. But it's broader now. We're also planning to do a bike ride from Newark, New Jersey, all the way down to Trenton. Again, spreading the message about sickle cell awareness. We know that the problems that we have in our urban communities is that we don't have enough resources. We don't have the treatments that people with sickle cell need. In the city of Trenton, they have to go to New Brunswick for treatment. So you think about if your work schedule, transportation costs, school work that you have to make up, it can be very expensive. I'll be nice about it. It's very expensive. And if you have insurance, how are you treated? The types of treatment that you can get. We know that they should have treatment teams, when you're inpatient and outpatient. How do they coordinate those efforts together? And it can be extremely difficult, but we know if they can, the outcomes are so much different. And so when we link the comprehensive care of treatment with your teams for behavioral health, to be able to deal with those social, emotional feelings that they're feeling. Having good treatment also extends your life expectancy. And so the bills that I'm working on right now, as Victoria mentioned, is A4052. And it's for empowering our federally qualified health centers to get more access to updated treatment, more money, more research, more dollars for medicine. And that would be in Jersey City, Newark, Paterson, Plainfield, and Trenton. And so we know that if we're able to expand those services, people will live for a much, much longer lifetime, and they'll be able to live well-rounded lives. But when you hear stories like that, that's just one. And I have heard so many people talk about, well, do I have the trait? And how do I get tested? The awareness around giving blood. Part of the list that Michaela had was to do a blood drive. So we partnered with the American Red Cross and we did a blood drive. We had over 31 people give blood. And I'm talking African-American people give blood. Now, I'm going to tell you no stories. It was a stretch. I had to call and call and call, but that's the other bonus side, is that we need African-Americans to give blood in order to help out with research. We need blood for people with sickle cell for treatment. And it was just amazing. I remember one of the nurses saying, We've never had this many African Americans give blood before in this particular area. And now Mercer County Community College is doing a blood drive for sickle cell specifically. So I know that the word is getting out there. I know we're raising levels of awareness. We've also partnered, as I said earlier, with the school district. Brian Taylor's group has just been amazing. They came out and did a workshop to raise awareness about sickle cell to the nurses and how they treat students and why they might not be there. But also I want you to think about when you're sick and you go into these emergency rooms. Doctors oftentimes don't understand what sickle cell looks like. I have a very close friend that's an adult now, over 30, and he says, you know, when I go in and I'm having an acute episode, they think I'm on drugs because the way that they treat you in the emergency isn't normally the way that they treat you when you go see your doctors, but they don't have the treatment. They don't know what to do. And so they just want to try to bring you a relief and then send you off to your hospital where you have to go. But that takes time. And so we want to begin to educate our nurses as well, our emergency room doctors about it. But I think by us bringing treatment into those local areas, raising awareness, giving more options, is going to be able to help us help people's lives be preserved and live healthier lives. So that's just a brief scope of what this bill does. And I really want to let Brian talk about some of the details of some of the things that he's done. And I would love to come back. We have and do a full presentation just to go over like youth and their bodies and the things that they go through, and adults and their bodies and what they go through. But it's one of those things that we really need to know so that we can help better. When you think about other diseases and the amount of money that they get for research dollars, sickle cell is at the bottom of the totem pole. And so we feel like more we talk to groups like yours, we can elevate the cause and the concerns and the reasons why we need more assistance in that research and development space for sickle cell specifically. So I'm going to say push pause there. I'm going to let Brian come on and talk a little bit, and then we're going to open it up so that we can all have a conversation about that. Is that okay? Awesome.
All right, Assemblywoman, thank you so much for inviting me to join you today. Good evening, ladies. My name is Brian Taylor. I am the Senior Region Business Director for what is now Pfizer, what used to be Global Blood Therapeutics. And I entered the sickle cell space in 2019 when we were building out the small startup biotech company interviewed me about saying we have a asset for sickle cell. And I heard of sickle cell growing up, and I knew a few people with the disease, but I did not know sickle cell and understand it because the assumption was it was just someone that had episodic pain crisis. And that's what you've heard, and that's what you thought about. And then there were a few singers, namely T-Boz from TLC, and you would hear, oh, well, she's not on tour this week and she can't perform because of sickle cell. And then there was a rapper Prodigy from a group called Mobb Deep, who the same thing, and who suddenly passed away. And you started to get understanding of it. And in the sports world, you heard of Ryan Clark, who has sickle cell trait, but played for the Pittsburgh Steelers. He's an analyst on ESPN now. And playing at altitude, he went into a pain crisis. Now, this is with sickle cell trait. And he had to have his spleen removed because of the episode of the crisis. And so that was my knowledge of sickle cell till I got in. And then when I joined in the organization, I realized how much more devastating it is. I'll just give you a few facts so you understand. And when some of the women said it's a rare disease, it's approximately 100,000 people in the United States living with the disease, but 90% of them are African American. If I break that down, 1 of every 365 Black births, the baby has sickle cell disease. If I take that to the Hispanic population, that's 1 in every 16,300. If I do the Asian population, is 1 of 25,800. And then for the non-Hispanic white population is 1 of 41,600. Now, Verlina is absolutely correct in how sickle cell started. It really was beneficial to the body in the African countries and in India, as it allowed you to fight malaria. But what we're finding out here in the United States is that it has and you found over time, it has a much more detrimental effect on the body, because what is happening at its core is sickle cell disease is that you have a hemoglobin S molecule in your blood, in your red blood cells. That hemoglobin S molecule sickles and it forms a banana shape. When it forms that banana shape, they clump together, clogging the blood vessels and the arteries. What that's doing is it's now slowing down oxygenated blood from getting to all of the organs to the body. And that's essentially what sickle cell is doing. We have the breakdown of the red blood cells. And what then continues to happen is that you typically see it with anemia, and you have a low hemoglobin count. And then you also have what's called hemolysis markers, which is the breakdown of red blood cells, where you see the body trying to form newer red blood cells. Now, how does that manifest itself is that you see it typically in pain crisis. So when an episodic pain crisis, when a portion of the body, typically in the back or the chest, and sometimes in the shoulders, in the other extremities, no longer is getting oxygenated blood, the body forces it to say, okay, there's pain at that particular location. Now, the thing about this is that it's random. There's no idea of when this is going to happen, how long it's going to happen. And pain crisis typically can last up to a week or more. And at times you may have to be hospitalized. If you'll find with sickle cell is that, like Verlina said, if you're hospitalized, it's because a person living with sickle cell typically can manage on their own, but when they get to the ER, it's at an extreme point where they absolutely have to go in and seek remedy and some type of pain relief from that. And it's true. There is a significant healthcare disparity going to the hospital. When you talk with someone with sickle cell, they'll tell you that they're typically treated as a drug seeker, because the front desk, the nurse, the physician are not well versed in sickle cell disease. And so the experience that you have going in is significantly different than the average person going in. And so what happens is you have an inherent distrust of the medical system. You have an inherent distrust of the providers. And so you tend to retreat and go into your own shell. There are stigmas associated with it, because the only thing we think about is pain. But now let me share with you the other side of that. If there's no oxygenated blood flow or red blood cells getting to the organs can no longer live. So now you have organ death. It is the leading cause of pediatric strokes. The average life expectancy of someone with sickle cell disease is 30 to 35 years less than the average human. And so if the life expectancy in the United States is 72 to 75 years old, it's not uncommon for a person living with sickle cell disease to pass away at 30 to 35 years old. It's not uncommon to have someone pass away at 21 to 22 years old. That happens on a regular basis. Tomorrow is not promised with someone with sickle cell, because we don't know how the body is going to respond. We don't understand what's going to happen with the body. It attacks every organ in the body, because every organ in the body requires oxygenated blood to feed the body so that they can survive. I mean, if we think about a person that has a stroke, that's an ischemic attack. What is the response? There's no oxygenated blood going to the brain. We know that in the detrimental effects of that. Now, imagine if you're living with that from birth to death, that you have these type of episodes happening. As the Assemblywoman did say, it is a genetic disease passed down from the parents to the child. And I think that what's important is that many people don't even understand what their trait status can be if you're living with sickle cell trait. I mean, and so from a family planning perspective, it's important to know if you have sickle cell trait, if you plan on having a child with someone, what is their trait status, so that you understand that you may potentially have a child with sickle cell disease and understand what that involves. From a care perspective, children typically have the best care in sickle cell because they're usually treated by a pediatric hematologist in a sickle cell, comprehensive sickle cell program. In New Jersey, we have a comprehensive sickle cell program in Paterson and St. Joseph Hospital, another one at Robert Wood Johnson Hospital, and another one in Camden. In the Philadelphia area, we have two at St. Christopher's Hospital and at Children's Hospital of Philadelphia. But as you see, they're so spread out. In Philadelphia, when you talk about health inequalities, the children in North Philadelphia, because of their socioeconomic situation, can't go 9 miles to downtown Philadelphia to get to CHOP, where the care is probably some of the best in the world. Okay, so as Verlina said, if we're talking about in Trenton, if you're having, if you have a sickle cell episode and you go to Capitol Health in the city and that staff is unequipped to treat, you're typically going to have to either go to Hopewell or to Trenton, to New Brunswick to seek care where there are experts that understand the disease and will treat you on the disease. And there's no guarantee within that hospital that you're still going to get great care. And so that's really where we're going with sickle cell disease right now. And as an organization, we talk about innovation. I come from the pharmaceutical industry. And so we talk about innovation and finding new therapies to treat. In sickle cell, it is underfunded, under-resourced as others are. The common proxy is usually cystic fibrosis. Cystic fibrosis is something that there's tremendous awareness, tremendous amounts of research, almost 30-to-1 the amount of research dollars that are included in there, as well as a variety of therapies. In 2019, there were the first 2 new agents for sickle cell disease introduced that were approved by the FDA in over 30 years. And they're both disease-modifying agents. Now, I will have to give this disclaimer because of where I work and what I do. I can't talk about those publicly because that's something that you'd have to go in and because then that would change the scope of my discussion. But there are 2 disease-modifying therapies that have been approved in 2019. And so we're still fighting the battle to build trust with the community, build awareness with the community. And that's what led me to work with the Assemblywoman, is that what can we do? And our part is to provide education. We provide education to the school nurses. We'll provide education to the community so that we can raise awareness of sickle cell and understand the complications, understand how it manifests, understand how it's passed down from parent to parent, but also how people can get involved and what they can do to help out those that they may or may not know with sickle cell disease, because a lot of times they may not want to tell you, but they want the assistance, they want the help, and they want you to understand that they are warriors and true warriors, and do not judge them by the pain crisis, but judge them by the person that they are when they're actually out there normally walking around. And so that's where I am. And for more information, there is a website that I can share. It's called sicklecellspeaks.com, where you can understand more about the disease, understand the complications of the disease, how it's transpired. There's also videos for you to see, and the videos give you an idea of what's happening in the body, what those complications look like. I would also, in my role, when I interview people for the role, I ask them what they know about sickle cell. And I also suggest to people, there's a documentary on YouTube. It's called Spilled Milk, and it's fascinating and it's extremely powerful. It's about a young man living with sickle cell disease, and his best friend, he grew up in San Diego, and he was out essentially for having crisis, and his best friend documented his life and took them through his journey. You see them from high school until the young man, until probably about a year before he passed away. But you see the clinical changes in his body, you see what has happened, you see the effects of pain crisis, you see the effects of having strokes, that this person has had multiple strokes, and it is absolutely powerful to see what someone's going with. But I think what's even more powerful is the love of one friend to the other, to be there and be his champion and to document it and share his story. And that will give you a true journey of what that person living with sickle cell is going through. And it's only about 90 minutes. And I will tell you, I'm not too big of a man to admit I was crying the entire way, because it was that powerful to see this story and understand. And so I would encourage all of you to go out and check out sicklecellspeaks.com, but also look at Spill Milk if you want to see it in its entirety and see what that journey is. So thank you, and I will turn it back over to the Assemblywoman or to Victoria.
Well, thank you, Brian. Thank you for sharing. I was hoping you were going to give out those links to the videos and to the website, because they are tools that we would usually, share, and on your own time, you can definitely check them out. And it's all about awareness. It's about us advocating for additional funding, for treatment, for research, because it just doesn't happen by itself. So if you see stuff out there, participate, sign up, like all kinds of stuff we need you to do in our social media world, but also send in letters. If this is something that has affected you and you want to support someone, it doesn't hurt to send in a letter to the chairperson for Health and Human Services, for insurance and banking. The bill number is A4052, and share that you support this bill, or this is something that has impacted your life, or just in general that you think this is something that is very important and you want to see New Jersey do better. And so again, this is only a pilot. 10.2 million is like 2 nickels when you think about all the money that has to go into research, but it's a start. And so I know Assemblyman Conaway just had a bill passed. I'm co-prime with him on it for registering people with sickle cell so that the state knows that you have the trait or you have sickle cell. And I think so that you can get information so that you're aware about the disease and how you can treat it, how you manage that throughout your life. It's extremely important. And we want to be that bridge maker. We want to be the connector between living a healthy life, getting access to great medical care, and thriving in this world. And so that's just one way that we would appreciate any support that you have. But I want to open it up because I see Ms. Edmond, you are about to jump through the screen. You put stuff in the chat, and I know that this is personal for you as well. And so I think it's important that we all continue to support us as we go through this. Sickle cell is no different than any other disease, than cancer, than lymphoma, all types of diseases out there. So let's continue to support one another so that we can all live healthy lives. And I'll turn it back over to you, Ms. Victoria.
Thank you so much, Assemblywoman Reynolds-Jackson. And thank you, Brian. I really, really appreciate the two of you coming on, sharing, giving us that insight, that website for us to continue to support. And what we're here to do is to take that call to action, right? To write our letters in support. And I think you mentioned Department of Health and Human Services. Is that one place where we can actually, send letters of support? So if you could just remind us again what you meant.
I sure will. And I see Sarah on the call. And Sarah is also very informative. And I was saying the Health and Human Service Committee over in the Assembly and the Senate side, you need two houses have to agree on the bill, and then we hope the governor will sign it. And so if we'll put, and I know Ed is on the call also, my chief of staff, he'll put that information in the chat as well. If you want to send in letters in support of the bill, and ask for a hearing. This bill hasn't been heard yet. So do your research. If you agree, thank you. If you don't, it's okay. Send us some other ideas that you'd like for us to work on as well, because the list is long, but it's mighty, and that's what we're here to do.
I would also say that if you want outside, in addition to writing the letters in support of the bill, I think that the Sickle Cell Association in New Jersey does a phenomenal job.
Yeah.
And it's an opportunity to work with her. The executive director's name is Mary Lamar, but it's a small team, and funding is scarce, so they have to be very judicious and intentional where they go and what they do. But they take all help. And she goes from as far north Jersey, past Bergen County, from the border down to Atlantic City and Cape May. So she tries to do everything, but I think it's a good opportunity if you really want to go out and help, in addition to the letters, but also work with Mary Lamar at the Sickle Cell Association in New Jersey and really get involved.
That's a great idea, Brian.
And that's exactly what we do here at the Junior Leagues of New Jersey, the State Public Affairs Committee. We work together, we advocate on behalf of families, women, and children. And this certainly falls in line with our initiative and what we do. So we will certainly come back together, as a group, and we will caucus, and we will look to see how we can work together in support of this initiative. And certainly I'd like to, at this point, give Simone an opportunity to, maybe share a bit of her story. I do know, Assemblywoman, that you do have a tight schedule, so I just want to just be mindful of your calendar, and if you are able to stay on for a couple more minutes, or just
Okay.
what your schedule is, we want to be mindful and respectful of that.
I'm fine. Go ahead.
Okay. Simone, go ahead.
Hi, thank you, Assemblywoman, for coming out and, reaching out and talking the good talk for us. My son is 29 years old. He was a part of the Sickle Cell Foundation in Newark, New Jersey. He goes to Newark, Beth Israel. And we live in Monmouth County. We lived in Essex County at that time when he was born. I'm Black American, as I stated, and his father is Puerto Rican. And I never knew I had the trait. And his father never knew he had the trait until 2 weeks after my son was born. They sent a letter and stated that he had this disease. I asked my mother, and she's like, "Oh, you have something called a trait." But make a long story short, we have endured a lot during his process of growing up. And still to this day, not naming hospitals, but I live in Monmouth County, and the treatment is horrible. Still to this day. Some people will say, "Oh, he's 29. He's 29, but he looks like he's 16 because they don't grow as much as an average person that doesn't have sickle cell." And he has beta thalassemia, so it's SSSC, and he has beta thal. But as he is getting older, he's in the hospital more consistently. He takes hydroxyurea and folic acid, but the treatment in the hospitals, from just like you said, they're coming into the registration desk, going to the back, they're always looking at him like he's a drug seeker. That right there is so hurtful to me as a mother, because I don't care if he's 45 years old, I'm going to be there. So they're always thinking that he's seeking drugs, and at some points he's like screaming and yelling, and it's mostly in his back. It's always in his back, like his spine. So I would love to, get in touch with Mary Lamar and work with her, because I'm a mother, and we've endured a lot. We've endured a lot. So thank you. I don't want to take up your time, but I appreciate it. I have stories for days and experiences for days.
I also like to uplift the American Red Cross also, because they do a lot of great work in the sickle cell space because of the blood that they try to collect as well. They have a phenomenal team. And so I work with both of them. And I think that's another advocacy to be able to work with, to get information. I learned so much. I didn't even know.
Thank you so much.
Thank you for sharing.
And thank you, Brian, as well. Thank you. You're very knowledgeable. I couldn't have said it better myself.
You're welcome. You're welcome.
Fantastic. Any other questions that we have for the Assemblywoman or Mr. Taylor? Okay, Melissa.
So I have to be honest, I didn't read through the bill a lot. I just kind of glanced at it. One of the first things I noticed was the dollar attached to it. So, our experience in this committee is that bills that get, that have money attached are very difficult to push through. What kind of support do you have? Just tell us, walk us through that kind of stuff.
So the good news is that I do have the support of the leadership. And we talked about making it an appropriation where we don't have to go through the budget process, but making it a part of the state budget, which is different. And so it's more of a permanency. Right now, like I said, we just did one from Dr. Conaway that register you if you have the disease. this also is another one. So I expect that we'll be having to keep on pushing to have it come up for a hearing. We were looking for a half appropriation this year and the other half into 2024. So this is something that we're going to be working on during the budget process as well.
Great, thank you. Any other delegate that would like to raise a question to the Assemblywoman or Mr. Taylor? Okay, well, I would like to share my story. I have 3 daughters. They are 20, 24, and 25, and they all have the trait. 2 of my daughters have C and C trait, and 1 has S. Unfortunately, my husband passed away. He was 35,
Wow.
and he had SC disease. And so I do recall when I was pregnant, we did have really good medical care. So I was very fortunate. One of the questions that my doctor at the time asked, actually with the first baby, do you have sickle cell or sickle cell trait? I didn't really have an appreciation of what that even meant. I did not know anything similar to you, Brian. I had no idea. My husband, he, similar to what Simone has said, was told that he had the trait. And many times in the Black community, he was Cuban, in the Hispanic community or Black community, it's similar to someone saying, okay, if you're diabetic, but you have a little sugar, it's just one of those phrases that's used in African-American communities. So again, not quite understanding. So we were then educated at the time when I was pregnant with our first daughter. So, but then as we progressed along, I guess we didn't really think too much more about it because I didn't have it, he did. But then we progressed along, and then he had a crisis, he had an infection, went to the hospital. They didn't know how to treat him, didn't treat him properly. He passed away. So, and that was 20 years ago. So pregnant with the 3rd baby. So it is, still very painful, but at least I feel like I can at this juncture, 20 years later, be able to at least speak about it.
Yeah.
But I mean, I think I would probably be in a position now that I would feel comfortable writing letters or partnering. My kids are older, so maybe, there's time that has passed that I can, feel comfortable, looking at it from the point of view of perhaps helping others so that they don't have to experience what I experienced as a young mother and then raising the 3 girls. The middle baby, she has S trait, and very good. When she went to college, she was on a full ride soccer scholarship. Part of her, I guess, onboarding through the medical team, asking if, the Black athletes, if they had sickle cell. Turns out, we saw the paperwork. I knew she had S trait. And what was explained to me then, I did not realize it was an education, a continued education, that there are some athletes who, when they're, running and their heart rate is racing and increasing, that they could actually have some sort of episode, and it's to happen with S trait. And so she was very quick and fast, and she was a forward. And so they were able to use that so that she could, because typically with soccer, if you go out in the first part of the game, you can't come back in. But because she had sickle cell trait, she was allowed to come in and out at will, just to rest her body.
Oh, wow.
Because there have been athletes, we were told at the time, there have been athletes who passed away on the field, football players, because they had S trait, not sickle cell, not SC. My husband had SC disease. So, and the other two girls, they would get shortness of breath a little bit. They had C trait whenever they ran. So all three girls were athletes, but the middle baby who played soccer, she was she played soccer and, you know, was a Division I athlete. So I do have experience as well, similar to Simone, and that just because some, you know, people may have the trait doesn't absolve them for potentially having some sort of, you know, debilitating, you know, disease. And we were told when the girls were infants that they had to screen their marriage partners. So very much aligned with what both you and Mr. Taylor are saying regarding just being educated, having awareness, and helping out the next generation of families.
Awesome. Thank you so much for sharing. And you know, we also try to do some myth busting. So Brian, we're going to have to come back because this was just like the tip of the iceberg. You know, even when you have sickle cell, the Red Cross still would like for you to be able to donate blood so that they can continue to do the research as well. And so, you know, I think just being aware, like you said, about how to manage the disease like we do other chronic health diseases is a part of that campaign. And so it starts, you know, when you're very young, but we want to make sure that everybody has equal access to healthcare. And that's the struggle space that many people are in. And that's where we're trying to raise the awareness. And the New Jersey Sickle Cell Association and the American Red Cross do a fantastic job at that. And so that's why I like to partner with them as well to do that.
I would absolutely echo that and say awareness is key. We have to raise awareness to the broader community and not just those that are impacted by sickle cell. The more we understand, the more we'll be willing to do, the more voices are raised to elevate the treatment, elevate the care, and to eliminate some of the healthcare disparities that this particular population experiences. So I want to thank everyone for allowing me to join and share what I have, but also to Simone and Victoria for sharing your personal stories as well. Thank you.
Thank you so much.
And thank you both very much. And we will absolutely invite you both back. Thank you to Ed for helping to coordinate, and so very much appreciate your time.
You're welcome. Have a good night, everyone. See you soon.
Good night.